for the sake of time, can we move on to Carmen? And we will accommodate Raymond after Carmen. We can see it now.
Okay.
Go ahead.
Perfect. Thank you. Welcome, everyone. My name is Carmen Klinger, and I'm presenting today on behalf of the Food Zamza project, which is an international research project between the University of the Western Cape, the University of Cape Town, the South African Medical Research Council, and LMU Munich in Germany, where I'm based at. I'm presenting the work of the work package 2, which tries to identify the recommendations for and practices by the formal food industry to address undernutrition and the double burden of malnutrition. And we're doing this by conducting a scoping review. First of all, I don't have any conflict of interest to declare. This is the agenda for today's talk, so I will give first some background information on the framework that we're using in this project, as well as the double burden of malnutrition. Afterwards, I will give you an overview of the current status of the scoping review that we're conducting, and in the end, I will finalize with an outlook of the project. The framework that we're using in this work package 2 of Food Zamza is the Informer's BIA obesity tool, which is a framework that tries to assess and benchmark the policies and commitments of the private food sector related to obesity and population nutrition across the 6 key domains that you can see in this picture, which is on the product marketing side, product formulation, nutrition labeling, promotion to children, and product accessibility. And on the strategy and governance side, it's corporate population nutrition strategy and relationships with external organizations. The current tool does not yet consider aspects of undernutrition and or the double burden of malnutrition, and that's why the overall aim of this work package is to identify indicators that look at undernutrition and the double burden of malnutrition to be added to the current tool. I believe most of you do know what the double burden of malnutrition means. This is the coexistence and interaction of undernutrition along with overweight and obesity or diet-related non-communicable diseases, either within individuals, within households, or entire populations, and across the life course. This phenomenon is especially prevalent in sub-Saharan Africa and Southeast Asia. That's why we chose South Africa as a country where this new adapted tool will first be piloted. So where are we standing with the scoping review? As I said before, with the scoping review, we're trying to identify indicators on undernutrition and the double burden of malnutrition that will be added to this existing framework. And we've already published an a priori scoping review protocol with the Open Science framework. So if you want to read up on our exact methods and on our inclusion-exclusion criteria, feel free to consult the link below. We have already searched relevant studies and have finalized a list of included studies, and we are currently at the data extraction stage, which will then be followed by the data synthesis. And before submitting the manuscript, we will also, of course, fill in the PRISMA checklist for scoping reviews. To go a little bit more into detail regarding what has been done so far, we started the entire process by conducting a preliminary search for existing scoping or systematic reviews to just avoid any duplication of work. We then screened 36 key publications for important keywords, which can be used in our searches. And we then ran our searches in 3 bibliographic databases and 5 gray literature databases, as well as on Google and Google Scholar and on relevant websites of institutions and organizations. We will also contact study authors of all included studies, as well as additional experts in the field, to provide them a list of our included studies and to just ask if there's any relevant document missing. After running the searches, we deduplicated our search results, and we screened all titles and abstracts as well as full text in duplicate, and we ended up with 151 included records. So this includes academic, but also gray literature. We will also conduct backward and forward citation searches of those included records, and in the end, extract the data and chart and summarize the data. As you can see here, we did include 40 studies or documents that focused on a high-income country context, because we did have enough studies and documents that only looked at low and middle-income countries. So what is coming up in the next couple of months? As I said, we're hoping to finalize the scoping review by the end of this year. This will be followed by an adaptation of the framework for countries facing a double burden of malnutrition using a Delphi process, where we will present our results of the scoping review to an expert panel in several rounds. So this will be an iterative process, basically, to be conducted in the first half of 2024. And this will then be followed by piloting this revised framework in South Africa for the first time, also starting in the early next year, because we can also already start with data collection without having the final framework ready. Overall, the aim of this work package is to have, in the end, a comparatively simple assessment tool that can be easily implemented in countries facing a double burden of malnutrition with a resource-constrained research setting. However, a pitfall here is that the framework is not assessing the actual implementation status. So it only assesses the policies and commitments, but not assesses if this is actually implemented. So this has to be done in a second step. And also, I wanted to give you the information that during the methodological development, we will not have any inclusion of the food industry or any engagement with the food industry. However, when we will pilot test the revised framework in South Africa, we will reach out for verification of documents that we identified online with company representatives. This is part of the VIA obesity process. And while doing this, we will also try to seek feedback on the current tool. What we are going to do with this feedback, we don't know yet, but we will still give the food industry a chance to reply and to comment on the tool and also on the new indicators that were added to the tool. Thank you very much. A big thank you to the Food SAMSA team that you can see in this picture, and to our funder, the Federal Ministry of Food and Agriculture in Germany. And here's my contact information. Feel free to reach out. I'm always happy to connect with people working on the commercial determinants of health. And if you have any thoughts on engagement with the food industry, at what stage they should be or should not be involved, I'd be very happy to talk about that. Thank you very much.
Wonderful comment. It's so nice to see the strides that you made with your systematic review.